I think there are a lot of health disparities,
Mhm,
unfortunately, and I find that that's much more prevalent in women of color,
mhm.
um, where we're not given information that we should be receiving, or that we're going for unnecessary tests
Right.
um, and surgeries. I mean, the rates of hysterectomies in African American women
Yeah,
are much, much higher
yeah.
than in comparison to the Caucasian population. So these are the healthcare disparities that exist in our society. And it is not only my own individual responsibility as a woman of color, but
Mhm.
as a doctor of color to be able to educate my patients. And I feel it's a responsibility for doctors in general, but definitely doctors who are of color should be taking that on as much more than we do.
Welcome to Sheila's Take, your go-to podcast for thoughtful insights on love, faith, health, fitness, relationships, and navigating today's challenges through a spiritual perspective. Join me, Sheila Dunbar, as we explore various aspects of life with a mindful and godly approach. Tune in for engaging discussions on all things meaningful and transformative. Welcome back to Sheila's Take. On today's podcast, I have Dr. Soma Mandal, a prominent midlife women's health specialist and the author of Dear Menopause, I Do Not Fear You, a modern woman's guide to thriving through midlife. She's my esteemed guest, and I'm so happy to have her. She's recognized globally as a leading expert on menopause, especially for women of color, which is very important. Dr. Soma Mandel is an accomplished author, public speaker, and media entrepreneur with multiple accolades for her contributions to the field. Welcome, Dr. Mandel. How are you?
Thanks, Sheila. Thanks for having me. I'm great. Thank you.
I appreciate you taking your time to stop by my podcast and advise my listeners on health. What drew me to you was the fact that you deal with a lot of women of color. And again, we have a lot of issues in the healthcare system. So I'd like to talk about that, but a little later on. But can you share with my listeners how your background in both Western medicine and from New York University and Eastern roots will influence your approach to patient care?
Well, I think, that's a great question. I think if you asked me that question like 15, maybe even 20 years ago,
Mhm.
I would have said Western medicine is all that I know and it's the right way to go. Not even probably acknowledging my roots and that I
Right.
come from a tradition, a culture that has a lot of ancient rituals and medications
Mhm.
and that can actually help people. But I think as I've matured and entered into practice, and I've been practicing for, giving away my age, but I've been in practice for almost 25 years now.
Okay, wow.
Yes. um, I basically learned as I went along, and a lot of that came from my own patients,
Mhm.
where whether they were of Indian background or of Chinese background or other backgrounds, Haitian backgrounds. I've seen a lot of, if you want to call it alternative, I've seen a lot of traditional. That's the word that I use
Okay.
um, methods that they use. Some of them don't necessarily work, but
Mhm.
others do. So it's basic. It allowed me to kind of open my own eyes to understand that yes, we live in a world of modern medicine, and it's increased longevity and given us a much better life and increased lifespan. But there are a lot of different traditional methods as well that can also be used to treat certain ailments and conditions along with Western medicine.
Now, I know your work focuses on holistic and personalized approach to healthcare, right?
Yes.
Can you explain why this approach is important and how it will benefit patients?
I think, at least for my practice,
Hmm.
and for myself, I like to keep an individual approach to my patients. And so the word holistic can mean a lot of things. And for me, it means actually taking that person into consideration, where they're from, when they might have come to this country, what their diet is comprised of, what their activities may be that may be influencing their health. I think a lot of people have this perception that holistic means it's all natural, but
Right.
for me, it's the whole picture for that person and how it influences their health, both in bad and good in good and bad ways. Um, so, I always like to sit down with my patients and learn about them, in terms of, what their lifestyle is like. And that obviously includes what they're eating,
Mm.
when they're eating, what type of movement is in their life. And that's my own definition of holistic, at least in medicine.
It's um, interesting that you say that because recently, if you listen to my podcast, the last year or so, I went through a transformation. I had a lot of weight issues. I was diagnosed with type 2 diabetes and I had high blood pressure, anxiety, a whole bunch of things. It got to a point where my blood sugar and my A1C was really high. And I mean, at times I would take my blood sugar and it'd be like 300, 350. I mean, it would really be high to the point where I'm walking around like this. And I got to a point where I had to stop and I started a new diet and a routine. And when I went to my doctor, she was so amazed with the weight that I lost because I was about 75 pounds. And I saw a lot of drastic changes in my A1C and things like that. My medicine went down. I stopped taking medicine. And one of the things that she asked about, I come from a Southern family, and she was like, "Well, how did you change those eating habits?" Because a lot of times when you brought up that way, it's kind of hard to change how
Right.
you the kind of food because with the fried chicken and the macaroni and cheese, not saying they're bad, but when you're eating it constantly and
Right.
when you have health issues, and she's like, it's really hard sometimes when people come from certain backgrounds, but it's good to know your background so that I'm able to help you um transform or do something different. So when you said the holistic is not just about in my head, that's what I used to think about also. It's about eating natural and doing things, but it's the whole everything as a whole, your whole background, what you're used to because regardless of what you're giving a person, if they're not eating right or doing certain things, it's not really gonna help them. It's not gonna really benefit them.
That's right.
Um, you deal with women of color who may face unique challenges and experiences when it comes to basically menopause. How do you ensure that your approach is inclusive and addresses the specific needs of these women in your practice?
So I find that no one woman is alike.
Mm.
And I'll give you an example. Like, and this is a generalization. So I don't want people to think that, all Indian women present this way or all African American women
Mhm.
present this way, but that because there are variables within even in the same groups of people. Um, but it may be cultural because, like, for example, with South Asians, myself included,
Mhm.
um, they may not be ones who get bothered or have even the night sweats and the hot flashes, uh, but their presentation may be just general body pain and joint.
Mm.
And then you do a whole workup, which includes labs and x-rays and obviously examining the patient.
Mm-hmm.
Um, and I feel a lot of these women um, may be just dismissed because their tests are normal, right?
Right. Yeah.
Their tests are normal, their x-rays are normal, the labs are not showing anything, right? So you're like, oh, you might just be depressed. Here's some medicine and I'll see you back in 2 months. But different women present differently. So menopause can cause unusual joint pains, muscle aches, headaches,
Mm-hmm.
even like, believe it or not, things like itching of the skin. And the more common symptoms like the hot flashes, the night sweats, right, the irritability, the
Yeah.
insomnia are what are most discussed now. And I'm glad that it's more in the mainstream and that there's more outlets like the New York Times that are
Mm-hmm.
recognizing, that it is a thing and we should be more aware of it. But there are a lot of doctors, and I would include myself on this one too, because I feel more of the learning curve happened well after medical school, well after residency, in terms of learning about this and how it can really affect women, um, not only of different cultures, of different backgrounds, um, but how to approach people in terms of, okay, let's talk about putting you on this medication, see if you do better.
Mm-hmm.
I often feel like we're dismissed, and I include myself on this one,
Yeah.
that we're dismissed because um, doctors don't necessarily want to deal with this particular issue.
Yeah, yeah. I could see that, are there like a lot of common misconceptions or myths that you often encounter and like
Yes.
like how
Yeah.
how how do you address them?
So, one of the things like I address them on a daily basis, right? Because when women say, well, I better get my mammogram because now I'm menopausal, I'm like, well, that's true. And
Mhm.
you should get your mammogram. But so I try to educate them along the way. But I'm like, your risk of breast cancer isn't increasing because you're menopausal.
Right.
It's because you're getting older, right?
Mhm.
So it's like little teaching points. And then you'd be surprised how many women don't realize that menopause puts them at higher risk for heart disease. And that's a big one. That's a big one, especially in certain
Wow.
groups like yourself as well as mine.
Yeah, I never
Um,
knew that. I never knew that.
yep. And so the game that, we have the advantage of estrogen
Mhm.
over, and that it gives us that advantage in terms of heart disease. But 5 years after menopause is when things kind of level out
Yeah.
between men and women, and we're at that same risk as they are. And
Wow.
yep, and a lot of women don't know that. And so they're like, I'm not having chest pain. I haven't had any issues. Why are you sending me for XYZ tests? I'm like, well, you've been in menopause now for 5, 7 years, right? There may be a family history, or they might have, their own individual risk factors. So I'm like, now's the time when we need to get all these tests going. So we make sure, right, that you don't have heart disease. So 5 years from now, you don't have a serious or fatal heart attack.
Yeah, I've gone to the doctor and I don't know if I've hit that yet, but I've never been told that. In any of my exams or anything, I've never heard that was one of the things that you're at risk of having during menopause.
I think there are a lot of health disparities,
Mhm.
unfortunately. And I find that that's much more prevalent in women of color,
Mhm.
um, where we're not given information that we should be receiving, or that we're going for unnecessary tests,
Right.
um, and surgeries. I mean, the rates of hysterectomies in African American women
Yeah.
are much, much higher
Yeah.
than in comparison to the Caucasian population. So these are the healthcare disparities that exist in our society. And it is not only my own individual responsibility as a woman of color, but
Mhm.
as a doctor of color to be able to educate my patients. And I feel it's a responsibility for doctors in general, but definitely doctors who are of color should be taking that on as much more than we do.
And yeah, it comes to a point that we have to speak up for ourselves too. We have to be advocates for ourselves, but we do look for our doctors to give us the information that we need so we can make certain decisions for ourselves and know certain things. Are there some like key lifestyle changes or strategies that women can implement to thrive through midlife transitions, particularly through menopause?
Yes, I the first thing is to know what may be triggering you instead
Hmm.
of dismissing it, you know. So like a lot of women tell me, I've noticed that when I have a glass of alcohol now, that my symptoms get worse, right? And I'm like, well, that's a thing, right? And so I try to educate them. Well, what do you think is going on? They're like, I don't know, but I'd never had this issue before until I hit this particular age. But like the alcohol is causing hormonal imbalances. And things like if
Mhm.
you're drinking too much caffeine,
Right.
right? If you're not sleeping enough, if you're not eating right, if you're having too much junk food, if you're drinking too much, and a glass of alcohol, and I'll just, this is not a wine glass here, but a glass of alcohol is about this big, not
Mhm.
the entire glass. So some people are having like a full glass of wine, so you're having 2 there, and if you're
Yeah.
saying if you're filling that up again, that's actually 4 glasses of wine that you're drinking. So just knowing, sometimes keeping a little diary, right? That
Mhm.
where I noticed that when I eat this thing, right, I feel this way, and picking up, patterns on that. And it's at this stage of life when we're perimenopausal and noticing changes in ourselves,
Yeah.
right? And obviously menopausal, and if you're having symptoms related to that, to be able to really focus on the healthiest life that you can live. And that includes your diet. So we stress that Mediterranean diet over and over again because we know that's what keeps us the healthiest, which comprises of fruit, whole grain, vegetables, lean proteins like chicken, fish.
Mhm.
And there's a whole array of food that you can find within that diet. And portion control.
Yeah.
So not eating too much because, as you are probably aware, menopause, perimenopause is a time when we can gain weight.
Mhm.
So the portion control is also key, even when you keep a healthy diet. And then the 2 last parts of that are, well, maybe 3, but stress management. And we all live in a society where we have deadlines and
Yeah.
responsibilities and all sorts of things. And the sleep. So if you're not sleeping enough, that will take a toll. And, it's a little tricky with menopause because sometimes menopause causes you not to sleep.
Mhm.
So
Yeah.
working on all those things is really important. And then I said possibly 3, and the
Right.
third, exercise.
That's what, because I was saying, what's the third one? I'm waiting. I want to hear the third one. I definitely agree with that. That's important. Um, let's talk about your book a little bit. Dear Menopause, I Do Not Fear You. It aims to empower women through midlife transitions. What motivated you to write this book, and what key messages do you hope your readers will take away from it?
It's like I look at it as like a small booklet, kind of gives people some basic information in a kind of fun way, nothing too serious. where they learn some key points, some of the myths, some of the facts regarding menopause,
Mhm.
so that they can then approach their doctor with questions like, "Hey, when should I be having my heart screen? Does menopause put me at increased risk for the XYZ?" It's a way for women to have more open conversations with not only their doctors but hopefully other women as well.
Okay. How do you see the future of healthcare evolving, especially in terms of integrating traditional and alternative medicine practices?
I'm hopeful. I've
Mm.
certainly, I mean, I won't say that I am an Eastern practitioner.
Mhm.
I certainly support a lot of things like acupuncture
Yeah.
and Ayurvedic medicine. So I try to incorporate that in my practice and I steer my patients in certain directions when I can. Um, I feel that we need to be much more open-minded as a group, and I'm referring to physicians in general.
Okay. Okay.
Because I think a lot of us obviously went to medical school and we learned this kind of were channeled through one way of learning how to treat patients. Um, but we live in the world where a lot of different ways are used, whether we want to or not, right? Our
Mhm.
patients are still seeking these things out. So I think it's important for us to be at least knowledgeable, to have some knowledge about these treatments. And some of these things I don't necessarily support, right? I don't necessarily think they are helpful.
Mhm.
So, but to actually read on these things and talk to your patients
Yeah.
and find out, right? Like, is this supplement, this herb, this vitamin actually helping them or doing nothing or actually causing them harm? So
Mm.
again, we come back to that keeping an open mind so you can actually learn and figure out if these treatments, alternative treatments, are helpful or not.
Do you think that there's going to be a little bit more um, awareness for women dealing with menopause and things like that going forward?
Well, I think when you look at this past year, last year,
Mm.
right? I mean, there was this huge article in the New York Times, and I think it gave a lot of women information like, okay, this is how we should be approached, and it opened a certain door. And I think on mainstream TV, a lot of doctors are coming out and talking about it. So I do think that in comparison to like 5, 7 years ago, I think there's a lot more awareness, which is
Okay.
good, obviously.
Yeah, I mean it definitely is. I ask all my guests this. What are you grateful for?
I'm grateful for my life.
Mm.
I am definitely grateful for my family. And I'm grateful for all the blessings that I've been given. I've worked extremely hard to get to where I am.
Mm.
So not, I won't say anything was given to me on a silver spoon, but just to have the ability to go to the schools that I've gone to, like I don't take any of that for granted. I'll tell you, like I was in the city with my daughter a few weeks ago.
Mhm.
Yeah, it was about 3 or 4 weeks ago. And she wanted to see where I went to medical school. So we walked across town and I showed her. And I was looking at it and I was like, oh my God, I went to medical school here.
Yeah. It was
And I was like,
surreal.
yeah, I couldn't believe I went to school here and then I made it. Right. I've been so blessed,
Yeah.
right? So I have a lot to be grateful for.
What's
Now,
next? What's next for you? Any more books coming or anything?
yeah, so I'm actually like trying to make more connections with the world, and
Mm.
I've been really active on Instagram and talking about women's health as it pertains to many different things, not just menopause, but heart health and diabetes and anxiety and depression. And these are the things I talk about with my own patients, but I hope to be doing more podcasts, hopefully be on mainstream TV in a little bit, radio and all that good stuff. So and I've met some fabulous, fabulous people along the way. And so I hope to continue making those connections.
You're talking about things that is so important, especially nowadays with everything going on. Let my listeners know how they can reach out to you, how they can, you have a website, how they can get your book. Can you give us all that information?
Sure. Sure. You can find me at somamandalmd.com. And you'll find all my social media handles, Facebook, Insta, Twitter, and LinkedIn on my profile. And you can find my book, Dear Menopause, I Do Not Fear You, on Amazon.com.
Thank you so much for stopping by and blessing my listeners with your expertise. Again, like I said, you told me some things today I didn't even know about. So when I go back to my doctor, I have a couple of questions I'm going to be asked. And she's going to wonder where that. I'm going to let. So I'll let her know. But I appreciate you, and please, if you ever want to come back, you're welcome to come back and talk about
Thank
other
you.
things. But again, reach out, my listeners. If you want to get Dr. Soma Mandal's book, please make sure you do. And again, she's on Instagram, she's on Facebook and LinkedIn. Thank you, Dr. Soma Mandal, and I appreciate you.
Thank you, Sheila. It's been a pleasure.
Until next time, remember to embrace the journey, build lasting connections, and step boldly into all that life has in store for you. I'm your host, Sheila Dunbar. Blessings to you.